Hey everybody, just getting situated here. We are getting ready to start our fasting work girl chat for tonight. And Dr. Rogers is joining me. And as always, if the connection gets blurred, let us know so I can try to fix it. Right, so we are connecting, and I think you can see us. All right. We are live now. And good evening, Dr. Rogers. Thanks for joining us.
Good evening.
We are excited. So tonight, guys, we are going to talk about different markers of obesity, different health markers, things that you may or may not be aware of, and kind of delve deeper, because I think a lot of people hear, you know, I'm overweight or I'm obese, or like, what does that actually mean? So we're going to go through that. And then at the end, we will have time for your questions. So hopefully you guys will find this helpful. Just before we begin, I have to give our disclaimer. So neither myself or Dr. Rogers, we are not your personal physician. So this is an interaction via Instagram, therefore we do not know your personal situation. And so what we are talking about is just for informational purposes, not medical purposes. So if you have a question about anything that we asked and you want to try to implement it into your life, talk with your healthcare provider. Find your primary care physician, or whomever is accessible to you where you live. Establish a relationship and see if this actually applies to your personal situation. So with that said, I am going to introduce Dr. Rogers. So Dr. Kimberly Rogers is a board-certified internal medicine primary care physician, currently serving a geriatric population in inner city Philadelphia. In an attempt to better manage the various aspects and comorbidities of chronic diseases of her socioeconomic disadvantaged population, she has adapted a strong lifestyle medicine focus into her practice, integrating sessions of dedicated nutrition and weight loss counseling to her patients. Her passion is to help patients recognize the value and importance of lifestyle modification and nutritional therapy as a means of treating chronic disease. And I just think that is fantastic. The Philadelphia area is very lucky to have a physician like yourself. So if you guys are in Philadelphia, you should look her up. But with that, what we'll do is I have a series of questions, so we'll jump right into it. And then hopefully as you guys are listening, it may prompt some questions of your own. So I think the biggest thing to start off is just what exactly is obesity? How is that defined?
Right. So I just want to start off by saying that the word obesity is a sensitive word. And I think that when we say it, a lot of times it kind of makes people cringe a little bit. Mm-hmm. But I just hope that at the end of this, people realize that the word obesity is not a judgment. It's not a discussion about anything other than health when your doctor is talking about it. So I have two definitions, and I just hope my computer doesn't die while I'm reading these definitions out. So if it does, I'll just have to wing it. But anyway, so I have two definitions. One is like a standard one, and one is a medical one. So the Webster's Dictionary defines obesity as a condition characterized by the excessive accumulation and storage of fat in the body. Okay? Plain and simple. The Obesity Medicine Association's definition I love, and it is defined as a chronic, relapsing, multifactorial neurobehavioral disease wherein an increase in body fat promotes adipose tissue dysfunction and abnormal fat mass physical forces resulting in adverse metabolic, biomechanical, and psychosocial health consequences. And I really appreciate that definition because I think that it keeps the concept of obesity in a medical light, and it really kind of breaks it down for what it is, which is a disease that causes other diseases and causes other problems. So when we talk about obesity, that's really what we're talking about.
And I love how you broke that down. And I also like the Obesity Medical Association's definition, because this is not a word that's supposed to be thrown around to shame people or this or that, or,
Exactly.
you know, you're not going to be on the cover of Vogue magazine, or, you know, this, that, or the other. We are trying to use it in a medical sense so that we can help optimize people's health. So
Absolutely.
I think that was spot on, and that's what I hope people take away from that. It's not saying anything about you. It's not saying, you know, anything about your motivation, your goals, all these stereotypical things that we hear, you know, thrown around. Mm-hmm. It's when your doctor talks with you about obesity, it is not anything about anyone making a judgment. It is about how can we help you maximize your health.
Right.
So I think that's extremely important. A couple weeks ago, I did a poll on Instagram Live where I asked people, you know, when you hear BMI, like, what do you think? And it was an open-ended question. Mm-hmm. And so a lot of the responses that I got were that, you know, BMI is useless, BMI is outdated,
right?
You know, BMI, blah, blah, blah. So what is that? I guess, what actually is your opinion on, is BMI outdated? Exactly what is BMI for people who don't know, and how does that kind of fit in with our health?
Right. So great question. So let's just start off with the BMI definition. So BMI, body mass index, is an equation where you take somebody's weight divided by the height squared times a factor of 7 or 3. But the easiest way to calculate it is to do what I do and plug the numbers, weight and height, in a calculator, and it's going to spit a number out. Mm-hmm. And so the concept is that somebody's weight at a certain height, there should be a kind of general range for what is considered healthy. So that's the assumption, okay? So a normal BMI is between 18.5 and 24. So a BMI of between 25 and 29 is considered overweight. Okay, that's a medical term. A BMI above 30 is considered obese. And then you go up to morbidly obese if the BMI is above 40, mm-hmm. or if it's above 35 with some other kind of comorbidity. So that is what BMI is. And just, you know, there are definitely arguments against it, and I'm going to touch on that. But what I would say is that the science shows that there is a very strong correlation in general between higher BMIs, mm-hmm. and other poor markers of health. So in general, and I keep saying in general because everybody's different, it's not a one-size-fits-all situation at all. But in general, people in an overweight or obese category of BMI have been found to have an increased risk of metabolic syndrome, diabetes, high blood pressure, cholesterol, cardiovascular disease, and then things related to the physical forces of that extra weight, like obstructive sleep apnea, osteoarthritis of the joints, breathing problems, chronic inflammation, cancer, etc. Mm-hmm. So, you know, of course, there are exceptions to the rule. So, as I said, BMI is it's a screening test. It's not a diagnostic test, and so it makes certain assumptions. So, just to give you examples of why it can be considered flawed. Different levels of body fat vary among different demographics. So let's say I'm a female and I am, 5'8" and I weigh 135 pounds. And there's a man who is the same height and the same weight. in general, my body fat percentage as a woman is going to be naturally higher. That's just the female anatomy, okay? So BMI doesn't really account for that. There are also racial differences. So in general, people of African descent tend to have a higher muscle mass. And so you might have an African American at the same height and weight as a Caucasian or an Asian, and the African American will be less likely to, or I should say, have a lower percentage of body fat at that height and weight than somebody of a different race. Then you have age differences. So as we get older, our amount of body fat naturally increases. And so I might have an elderly patient, because that's my patient population. I might have a little old lady who is at a quote unquote healthy BMI, but her body fat percentage is higher because her muscle mass is actually lower, and the BMI does not account for that. And then last but not least, you know, you might have an athlete, a 250-pound, 6'3" football player who is obese, but that body fat percentage is actually relatively low. So the BMI does not really, it's not very sensitive for that. It's just a generalization. And the other flaw with it is that it doesn't really tell you where that fat is distributed, because that matters too.
Right. No, and so there's a lot of things to take in account to that. And the other thing as well, when you talk about BMI, the BMI categories also change depending, like for instance, Asians are considered, people of Asian descent are considered overweight or obese at lower BMIs because of their genetics and their structure. So you have to be careful when we're trying to just apply something all to the map. So there are definitely things about the BMI that leave much to be desired. When is there a time when I guess BMI might actually kind of have us consider that you could be at risk for disease?
Well, so I would say that if you're kind of in that gray zone of maybe the BMI is in that overweight category or low obese category, then you kind of can have that question. Is this really a marker of poor health? Does this person really have increased body fat percentage? I don't know if there's an actual cutoff for when I would say, well, the BMI definitely matters, but I would usually say if it's truly over, 35, I mean, there's not a whole lot of scenarios when somebody's going to be at that BMI and not have an increased percent of body fat. I don't think there's a specific number, but I would just say that as the BMI rises, the chance that that is related to anything other than, increased percent of body fat, which is dangerous, is very low.
And I agree. And so it's like, and we'll talk about some other measures, but when you're in that quote unquote overweight, or if your BMI is between 30, to 35 in that category, then we'll talk about like what waist circumference means and visceral fat and things like that. And I agree, I think some of those things come into play. But once you get over a BMI of 35, unless you're Terry Crews or someone of that, nature, I'm sure his BMI probably is like 35 or something.
Very well might be.
It's a BMI full of muscle. So that's different.
Right.
Unless you're in that situation, then you are incurring increased risk. So and just along those lines, can you talk a little bit about waist circumference and how that relates to health?
Sure. So one of the criticisms of BMI, like I said, is that it doesn't tell you where the fat is distributed, because where it's distributed actually matters the most. It's not all created equal. And so visceral fat actually is considered the most dangerous type. Visceral fat is the type of fat that accumulates in the organs of our abdomen, right? So we
Mhm.
call that the central obesity. And so visceral fat is considered dangerous because it's different. It behaves differently from other types of fat. It's actually metabolically active. And what that means is that it's producing hormones and chemicals, and it's increasing inflammation in the body. And it's actually, coating our organs, and it can even invade our organs like our liver. And that visceral fat really wreaks havoc. And so the other markers that can more accurately measure that would be something like waist circumference, right? So you take a tape measure, you put it around your waist, and if that number is above 20, 35, I think, inches in females,
Mhm.
and over 40 inches in males,
Mhm.
that is considered too large, and that is considered a marker of increased visceral fat. So if you kind of do that quick and dirty test, that can kind of help. And then another quick and dirty would be, you take your height and you divide it by 2. So say I'm 70 inches tall, I divide it by 2, that's 35. So my waist circumference should be about half of my height or less.
Mhm.
So if it's above that, that's considered another marker of increased visceral fat. And so there's this debate on, is waist circumference better? Is BMI better? And I don't think that there's one good answer, but what I would say in general is that both of them together are definitely more sensitive than just doing one or the other. At lower BMIs, like if somebody might be in that overweight or kind of obese category, and you really kind of want to get a better idea of where that fat is distributed, if you add the waist circumference, I think it just gives you more data. And if both of those things are abnormal, then that is considered, a worse thing than if somebody had a high BMI and they have a normal waist circumference. That really would suggest that the distribution of fat is such that they're really not in that unhealthy category.
Mm-hmm. And I did a post, and it was to talk about and lead into this discussion of waist circumference a few weeks ago now. And I quoted Sir Mix-a-Lot, where he said, little in the middle, but she got much back. So the thing is, it's not the back, that's hurting you. So you don't,
Right.
Whatever your back is, that's not going to make or break you. But it's we have the apple shape versus pear shape. And so again, none of those are meant to be characteristics that we're saying are desirable, are going to get you on the cover of magazine or not get you on the cover of magazine. Absolutely. But the waist circumference is an indicator of how much abdominal adipose tissue you carry. And we know the more adipose tissue you carry centrally, because it's metabolically active, that's why it can be a disease. And along those lines, there was someone earlier when we got on the discussion who asked, I saw it come across the screen, well, why is obesity considered a disease? Well, because many states and chronic conditions all start back with obesity.
Absolutely.
And there was a study that I just saw not too long ago that talked about the medical healthy obese person, right? So you carry excess, and we're not talking about someone who doesn't have the visceral fat. So say your BMI is 30, but all your weight in terms of like your muscle mass is like chest, arms, legs. You have that waist circumference that under 35. We're not talking about you. We're talking about the person who has BMI over 30 and has the visceral fat to go with that. So the whole picture. And even in people who have not been diagnosed with disease, their risk of mortality was 2 to 3 times than somebody who was not obese without the visceral fat. So that's the thing, because the adipose tissue is metabolically active and causes insulin resistance, which then can set off inflammation. And we'll get into some of this more, but that's why obesity is a disease, and you can link all the comorbidities, honestly, usually back to that. And obviously, it's not going to be everyone, right? You may have hypertension because you have an atrophic kidney congenital from birth, right? So then your hypertension is, but the vast majority of cases, you can link it back to
the vast majority.
Exactly.
Agreed.
So I think that's important to look at it. And again, it's not a value judgment. This is just to provide medical treatment and motivation for people to see why is it beneficial to even just lose 5 to 10% of your body.
Yep.
You know, you don't have to lose 100 pounds to get a health benefit. So
absolutely.
I think we have to keep that in mind, and be open if your care provider does discuss it with you. These are the reasons why they're discussing it with you. In terms of that, so we kind of talked about visceral fat. Do you think we have anything more to touch on that? Anything else you want to add about visceral fat? Or
I think that we kind of covered it, and if anybody had questions about that, you know, feel free to let us know.
Start chiming in. So in terms of that, so we talked about the waist circumference, we talked about visceral fat, and so I guess to get beyond the scale or some of those type of markers, what are other indicators of health that we can look at? Just kind of, you know, when we're doing assessment of what our health is like.
Right. So, you know, obviously BMI and weight is just one thing. And like you said, it tends to be linked to other things. But just to kind of look beyond, when I try to assess the health of my patient, so I kind of think about it two different ways. So there's tangible markers, so things that I can measure, things in the blood or the urine that can indicate poor health. And then there's the intangibles that I cannot measure, right? So I like to say that, so first of all, physical activity is extremely important. I can't measure that, right? But there was just a study today that said that diabetic patients who are more physically active have a lower mortality rate than people that are not. And so you might have somebody that you look at them and you think that they're overweight or obese, but they can run a marathon, right? Or you look at somebody that is a normal weight and that is quote unquote skinny, but is really deconditioned and really and really not fit. So fitness is a great intangible marker of health, and that's also important. And then you're talking about mental health, okay? So the mind and the body are connected. You might be a healthy weight, but emotionally you're wrecked, you're depressed, you're anxious. All of these things contribute to poor health. And then social wellness and social connectivity is so crucial, because we're human beings, we're social creatures. People that are lonely tend not to do as well as people that have a network of friends and family and loved ones. So those are the intangible markers of health. And then in terms of the tangible ones, you know, if I have a new patient or a patient, I'm trying to determine what their risk factors are. So what am I going to check? So we have things like vital signs. We're checking your blood pressure. We're checking your heart rate. So elevated blood pressure is a sign of your cardiovascular system being under strain. Increased risk of cardiovascular disease. Elevated heart rate is actually a poor sign of fitness as well, because if your heart rate is really fast, that means that maybe your heart is not conditioned. Maybe you walked 6 feet and you got tired and your heart rate is elevated. So in general, too high heart rate can indicate poor health, or too low of a heart rate. You know, if it's much less than 60, unless you're an athlete who is extremely fit and has a very efficient cardiovascular system, athletes tend to have lower resting heart rates. But in general, if it's too high, if it's too low, it can be a problem. And then we're talking about things that we can measure in the blood. So cholesterol, right? Triglycerides elevated, LDL cholesterol elevated, a low HDL cholesterol is associated with increased cardiovascular risk. And then, I don't even want to get into the whole different types of LDL cholesterol, but there are different types, and the small, dense LDL is the type that is associated with that increased, atherosclerotic effect and increased cardiovascular risk. And then we have other things like increased sugar. So increased blood sugar, fasting, increased A1C, that is obviously an increased risk for diabetes or pre-diabetes, and that is an indicator of insulin resistance. So our bodies, for whatever reason, are not really responding well to the insulin that we produce, and the blood sugar is hanging around too long, and that is increased risk for other conditions as well. And we have things like urine microalbumin. So microalbumin is a type of protein that spills from your kidneys if your kidneys are under strain. So a high urine microalbumin or a high albumin can suggest kidney disease, which could be related to high blood pressure or diabetes or other things. And then we have inflammatory markers. So I think we said the word inflammation a couple times. Inflammation is so crucial, and we are realizing that states of chronic inflammation are associated with like the majority of chronic diseases, because inflammation, you just think about damage, it's attacking your blood vessels, it's attacking your organs. Inflammation is implicated in cardiovascular disease, cancer, pretty much everything. So when we see certain type of inflammatory markers in the blood being elevated, that's an increased risk too. So CRP, C-reactive protein, is one that we check. It's a non-specific marker, so that means that if it's elevated, we don't really know why it's elevated, but in general, it can suggest some kind of dysfunction in the body. And then one that is kind of relatively new in being studied is the homocysteine. So homocysteine is an amino acid produced by protein breakdown, and specifically animal protein. And so I've been actually checking that in my patients. So all of my new patients, I actually add that on to the labs, and I see a really interesting correlation to poor health. So in general, the people that also have some of those other markers of poor health that I mentioned, including obesity, are more likely to have an elevated homocysteine. And the homocysteine being high is an increased cardiovascular risk as well, and in some cases can be related to decreased levels of certain vitamins like B12, folate. But, what is interesting is that when you supplement with B12 and folate and bring the homocysteine down, that does not in and of itself decrease the cardiovascular risk. You know what does? Changing the diet. Because that's the reason why in most cases it's elevated in the first place. And so I love checking the homocysteine, and I love checking all those other things, because it then gives me a really good opportunity to introduce the concept of inflammation as it relates to diet, and introduce the concept of an anti-inflammatory diet, which in general is a plant-based diet, just less animal protein, more plants. That is going to help you lose weight. That is going to help those numbers come down. And, even though I just mentioned all those other things, they're all connected. And like you said before, when we talk about obesity, when I think about obesity, I think about all those other things at the same time, because they tend to go hand in hand. And so when you get to the bottom of the underlying problem, many times it's lifestyle modifications. And I just kind of want to say that I saw a comment too. I just want to say there's always exceptions to the rule, right? So sometimes you have genetic conditions that cause, say, elevated cholesterol, right? There's certain types of conditions that no matter how healthy you are, no matter what your weight is, your cholesterol is going to be extremely high. But that's usually the exception. That's usually the exception. And so those type of cases, you're going to have to talk to your doctor about, you know, with the treatment for that. But in general, I love to tell patients, when you change your eating, when you increase your physical activity, you will lose weight, your blood pressure will get better, your sugar will get better, all those things will get better at the same time. And I love proving that to people, because my patients all the time, they kind of start losing weight. All of a sudden their blood pressure is dropping. I have to take them off medications. They love that. And so, you know, their homocysteine drops and their cholesterol gets better. So all of these things are connected. And that's the reason why obesity is considered a disease, because it causes some of those things. It exacerbates some of those things, and they're all kind of correlated. So those are some other markers beyond the scale of poor health. But I would say that in general, you can't really separate them, because they tend to go hand in hand.
Right. No, and I think that is very important. And I hope that we were able to give you guys an overview of kind of like why these different things matter, why it's important. I'm still testing out the format. And so some of the feedback that I've received is that even like, so we kept our discussion, you know, to about 30 minutes, but to give maybe like 10 minutes at the end to go through some of the questions. So we'll try that out this week and see if you guys like that or not, or if you just stop listening after 30 minutes, which a lot of studies say happen. I know. I'm like, a lot of people are like, get them in the first 30 minutes, because after that, you're done. But I'm going to scroll through some questions and we'll see what both of us have to think about these. So Glory to God for Life. She has a question. So I don't know if we'll be able to answer this personally, but we can give some general just topics. So I have a 17-year-old daughter, and she weighs 178 pounds, and she's 5'3". But she doesn't look fat. That's, I mean, I would say overweight, but she doesn't look overweight. But I'm afraid that she gets diabetes because she doesn't like to exercise and eats bad. So I have a few follow-up questions. I guess, what would eating bad be? Because I think first, when we link it all back to nutrition, right, they're different types of diets. And so for me personally, you know, which diet is better and this or that? Should you go Mediterranean? Should you go this? You know, I think one, if you look at maybe the amount of processed carbs in the diet, I feel like that gets a lot of people. And, you know, we hate to say good carbs or bad carbs, but, you know, plants are carbs, but I just maintain there's something different about the carbs in broccoli versus carbs in a Twinkie. And so I first would just go back and analyze the diet. When I work with people, I find that they have no idea of how many carbs that they're eating, like none at all. And then when we look at their diet, a lot of the high carb value in that is because it's processed foods. And so no one's saying that you can't have carbs, but for the school of people who are a part of the movement, I'm not trying to bash any movements, but there's a movement called If It Fits Your Macros. You know, I got to keep up on all the lingo and all this stuff.
I have no idea what that is.
Oh, yeah. It's like if it, IIFMY. So you'll see that hashtag different places, like if it fits your macros. So it's basically people who are like, they believe that you have to have a certain amount of carbs to protein to fat a day, which, you know, we can, that's beyond whatever the scope. But as long as you're fitting those categories, it doesn't matter what you eat. And so I don't agree with that, because I don't think that the carbs from broccoli are processed the same way carbs are from plain white bread or I mean, we can get into the glycemic load. Do you know what I mean? So you
Right.
can't, so when we're talking about your nutrition, and I think where people sometimes, you know, fall off is it's because of what are you eating. So I think that first looking at the diet and seeing if you can replace some of those meals that might be higher glycemic loads or come in a package or artificially processed with more whole foods. I think just starting off with that, you might notice a difference.
No, I absolutely agree. And, you know, I just think that if you try to decrease processed foods, you will automatically eat healthier because you will automatically just eat more whole foods. You'll automatically get more fruits and vegetables. And I really hate talking about starchy vegetables, carby vegetables versus, you know, I really don't like having those conversations too much because we're kind of like getting into the weeds. And I agree with you. I think when you're talking about as long as it fits my macros, there are like what thousands of diets out there.
Right.
And if there was one diet that really was the best thing, everybody would be on it and everybody would lose a ton.
Right, we'd all do it, right?
And so it just doesn't really exist. But the only one that really has been proven is just kind of less refined, you know, carbohydrates. And most of those diets do tend to kind of go into like less carbs, less refined carbs, and more kind of whole food type things. And so I guess going back to I don't know what the actual question of that comment that you said was. She was worried about her daughter having a bad diet. You know, I guess I would just say that there needs to be a conversation about what is in the diet and just trying to eliminate things that have a ton of added sugars, that are processed, that have a ton of ingredients on the label, you know. And if you do that, then usually you're automatically eating healthier. And then, as she said, she feels like her daughter doesn't exercise as much, and obviously physical activity is important. So, you know, doing those things will help. But it sounds like, you know, maybe she should definitely get an assessment from somebody to really kind of make sure that she's healthy.
And I would say, you know, maybe look and just see in your area, is there, you know, if it's feasible, is there a nutritionist that you could go to?
Yeah.
You know, or, and just kind of have someone analyze the diet.
Right.
Because I do think it will come back to that. And, you know, just to piggy off the same thing, like along with the, if it fits your macro movement, it's when people count calories as well. It's like, okay, well, you know, I can fill up my calories today with donuts. Again, that's not the same as broccoli. So it underestimates, you know, the importance of the contribution of whole foods to your diet. Because
absolutely,
what I always like to tell people is we were designed with whole foods, and, you know, whether you're religious or not, but if you are, I mean, whole foods were in the Garden of Eden. So, I mean, we were designed to eat whole foods. So, I mean, I think our bodies know what to do with that. And that's why you can see different cultures around the world who all are eating whole foods, but some might be eating a more plant-based diet. Some might have a little more meat in it, but they still have plants. And the common theme is the people are healthy. And where we get into it, we're starting to nitpick over some things. I think we just go back to the basics of trying to eat as few as packaged foods as possible, and things that you didn't prepare yourself, things that look like it's from an organic chem lab. I mean, I just think those basic steps, I think we underestimate how far those would go.
Absolutely.
But yeah, I definitely think having a nutritional assessment with your physician, and if your physician's not versed in it, asking for a nutrition consult, if that is feasible for you, I think that would be a good way to start to kind of have her assessed more objectively in a clinical setting. Healthy Mama Doc asked, great discussion. I briefly stepped away when both of you were discussing waist circumference. So I apologize if I missed this. Is waist hip circumference still used in women? So yeah, it's another one of the markers. And you can actually use it in men too, where you're basically dividing the natural waist by the hip circumference to give you, you know, an estimated risk. All of these are different tools. So
Yeah.
I think you just pick the one that you find you're most, I guess, experienced at measuring, because we kind of touched on how, like, or if we didn't, you know, if depending on body type, it may be difficult to measure the waist circumference because it's not as easily reproducible. Sometimes if individuals have a panis, it's where do you go around? And so, but yes, it's definitely a marker. And so I would say maybe just as clinicians, you know, we can get familiar with one that we think we're, you know, good at doing reliably to give people another marker. But yeah, you're totally right. Waist hip circumference is another marker.
Yeah, definitely.
And, yeah, you can use that as well. And then the other question, this is a follow-up for Glory to God for Life, because I think she was asking about her daughter earlier. My daughter's triglycerides are high and her blood test indicates she has inflammation. So yeah, again, I would say it's definitely probably worth finding a physician in your area who sounds like they've done some sort of workup, but now in addition to getting assessed, definitely seeing if someone can give nutritional advice specific for your situation.
I would definitely agree with that. And what I would say is this, a lot of physicians, we may not have as much of that experience in nutrition as you think. And so, like you said, you know, push for a nutritionist, push for a dietitian, because maybe, you know, your physician may not have that knowledge base to be able to give that personalized advice. And the other thing that I will say is that, you know, when you see all these kind of abnormalities as doctors, one of the things that we tend to reach for are medications, right? So it just depends on what the levels are. We're not saying don't go on medications for these triglycerides, or don't, you know, agree to take medications or anything like that, because I have patients on medications if they need to be until things get under control. But what I will say is just really always try to focus on getting to the root cause of the issue. So there's triglycerides, there's weight, there's inflammation, there's poor physical activity. And so instead of kind of treating all of those things individually, just really get into the lifestyle modification part of it is going to be so crucial for being healthier with that regard.
And, you know, and it's not to sound hokey or whatever, but it's like, you know, some of the greatest quotes was like, let food be thy medicine and medicine be thy food. Like, there is some, we used to do a lot of this stuff and it just got lost somewhere along the way. And I think, you know, the convenience and, you know, all of these things, we just kind of got away from what people used to treat things with. And so I'm definitely not saying, you know, just as Dr. Rogers has said, sometimes you got to be on medication until you can address the lifestyle, because I don't want you to say, well, I'm not going to take meds and your blood pressure is 170 over 110. Okay, well, you're going to have a stroke. So it's going to take time. This is the other thing people have to realize is, I know patience is hard, but your health condition didn't develop overnight. Therefore, the food is not going to reverse your condition overnight.
Absolutely.
So you're like, I ate well for a week. Why do I still have high blood pressure? You know, this develops over years, because assuming you were not born as a child with high blood pressure, it was a series of events that just over time. And so you got to give yourself the time. So, you know, you have to be open to getting your medical therapy, but also being motivated to see like, okay, I might have to take this blood pressure pill for now, but you know, if I make these changes over time, hopefully, you know, it will
You
help.
don't have to be stuck on it forever, hopefully. Yeah.
Exactly. J Weeks MD asks, so we know that you can't target specific body parts in weight loss. I wish you could.
I know.
But what are specific diet strategies for addressing the harmful visceral fat in particular? So
I think you just have to lose weight, you know, overall, because like you said, you cannot target it. I wish we could, because that, you know, pesky fat in the middle is the bane of my existence, right? But in general, you just kind of have to just do the strategies where you will lose the weight overall, and you will lose that visceral fat as well.
And there's not, I will say there's not as much data on this in the US literature, but when we look at some other countries, like Russia has had some studies on it. Obviously my handle is Fasting Work Girl. Dr. Jason Fung in Canada has some data now that they're, you know, more releasing about fasting, and some other physicians as well. And that with fasting, because it lowers insulin resistance, people will notice a decrease in their visceral fat, like from, but this is not just fasting without a healthy diet. So,
right.
And you, fasting can be as simple as like not eating after 7 p.m. at night, and then having your first meal at 7 a.m. in the morning. So, you know, some decreasing night eating, there is something about that with meal timing. There have been some studies where people who eat at night, so there was a really good study done that showed if you took people who, and they had the same caloric intake for the whole day, but the people who had their main meal after dark versus the people who had their main meal either for breakfast or lunch during light hours, the people who consistently ate larger calories after dark had higher BMIs and higher fat composition. So that is something that I would, you know, obviously not to you personally, even though I do know Jen, so I asked the questions, so this is, you know, we talk about this stuff. But I would say that while you're incorporating your whole foods diet, I don't necessarily, I mean, I agree with what Dr. Rogers said. I don't think that you're going to find it's the Mediterranean diet is better over this diet at getting rid of belly fat. But I think if you do consume a lot of calories at night, that is a good place to start, because you can eat the healthiest of meals, but we have a biological clock. They have the circadian rhythm, and all those things play into signals. So that would probably be where.
That's actually a really good point. And the other thing I thought about is cortisol. So increased cortisol due to stress actually has been found to give you a predisposition to accumulating more visceral fat. And so that's why kind of that mind-body connection is also so important, and focusing on your mental health and well-being is also a huge part of healthy weight loss, because that is, you know, that hormone signaling, like you said, those hormones can increase kind of the distribution of fat a little bit. And this is just totally random, and I haven't read the research, but I saw that there was this study that showed that a teaspoon, was it like apple cider vinegar or something? They just had some study. Did you see that? That came out saying that adding that to like a healthy diet was found to decrease visceral fat in the study participants. And I was like, really? But I don't know. But that's been around for a long time. That theory has been around for a long time. And I think some studies have discounted it, but then this recent one actually kind of reinforced that. Not saying that I'm going to go and tell people to do apple cider vinegar to get, you know, reduce their obesity, but maybe there's something to it.
Right.
I don't know.
And and I think, like you said, it's all these things in concert. So
Yes.
if you think that just the teaspoon of apple cider vinegar is going to outdo a diet full in processed, refined foods and things like that, it's not, you know? So
Absolutely.
I think it's the whole picture, and then, you know, the lifestyle modifications are key, and you have to find something that you are going to stick to for life, because I do follow the website dietdoctor.com, which is more of a low carb website.
Mm-hmm.
But I was at a conference where he spoke at, and he was like, yeah, so showers work as long as you take them. But we don't say that, well, I stink, so I quit the showers. Does that make sense? Like, if you have to keep doing it, was his point.
Exactly.
And
right.
so the thing is, like, when people
that.
are like, I tried the Mediterranean diet, you know, but then I stopped and I gained the weight back. Well,
yes.
Yeah.
Yes,
You know what I mean?
you
You went
did.
back to your old habits. So,
Yeah, exactly.
you know, Rome wasn't conquered in a day. You got to play around with different things, but find out which whole foods based diet, and I hate using the word diet, so which whole foods based lifestyle in your personal situation you are going to be able to stick to 350 days out of 365, you know, or 340 out of, you know, we all have times, but you know, it's not something that you can, you know, deprive yourself for 30 days,
sure.
and then you're not gonna be able to do that for life. So I think that's the key, and figure out which different lifestyle interventions you can integrate into yours. So
sustainability, yes.
Yeah. So I think that will wrap it up for us tonight. And then for Women on Clouds, I will get to this question. I'm actually going to have a campaign launch next week. So her question was, should we eat breakfast and lunch as a main meal or a full dinner while fasting? So next week, just to give a prelude, because I wrote a blog post on it that I'm going to post on Monday, and it's about this concept of reverse fasting, which talks about how you could incorporate intermittent fasting to benefit your circadian rhythm, and why it, again, if you're, you know, fasting, you can do, you know, 12 hours. You don't have to go a long time. Just give your gut a rest. But even consuming your meals between sunrise and sunset is better over the long run than if you're always eating after dark. So we'll touch on that more probably next week. So yay. Well, thank you so much for joining us. And it was a great discussion. We had a lot of people popping in on and off. So hopefully a lot of people saw this. And just as a reminder to everyone, I will post this also. It'll be in the stories for 24 hours, but I will also post it to my Facebook page. And then it also goes on my webpage at www.fastingworkgirl.com. And you can download it there. And then Dr. Rogers, tell us where we can find you at. Obviously we see your Instagram handle, but where can we find out more and follow your incredible work?
Well, so right now, I have my Instagram, so Dr. Kim Lifestyle MD, and I have a website, www.prescribemeanapple.com. It was down for a little while, but it's back up.
Right.
And that's actually the website that I started off with before I even got my Instagram page, and that has kind of healthy lifestyle tips, kind of all the stuff that we were talking about tonight, evidence-based lifestyle medicine tips, so that if you ever want to go to a website where you know there's going to be credible, kind of peer-reviewed studies proving these things, you can check out my site, and that's pretty much the two handles that I'm using right now.
Okay, no, that's perfect. And so if you want to learn more about plant-based nutrition and things like that, I would definitely recommend you check her out. And you might be able to find some practical tips and things that you can raise with your care providers to see how that would play into your life. So with that, we will say good night, and everyone, we will see you next week. Next week he goes by the handle of Al Keto Bonito, and he's going to be coming on. He's not a physician, but I found him through Instagram. He popped up as a recommendation, and he has lost 170 pounds without surgery on his own. And so I just want everyone to be able to talk to someone who has lost a significant amount of weight without surgery. And I'm not saying there aren't indications for surgery or not. There are different criteria, but I think sometimes people get overwhelmed and they're like, well, it can't be done. But there are people doing it every day with different lifestyle interventions. So we're going to pick his brain next week. So that's what's coming up.
Yay.
All right. Yay. All right. Have a good night, everybody.
Good night.
Thanks. Bye.